It started I've decided it's been about 10 or 11 years ago. My right hip, I started having pain, and it radiated down my leg into my knee, and it just gradually, progressively got worse, and eventually started affecting my left side as well, because I was overcompensating for what the right wasn't doing. So it was a long process, but it eventually brought me to Covenant, which was a very good thing. I couldn't walk correctly. I wobbled when I walked, and over time it got to where it was waking me up at night, just sitting. I would feel a radiating pain. It was continual pain. Just before my surgery, it was an excruciating pain on both sides. I attempted treatment with 2 facilities in Amarillo before coming to Covenant, and both declined treatment, saying that I was too young. One doctor even told me not to bother coming back until I couldn't walk. And yes, I was in my 30s, but not being able to be active in your 30s is, I think, maybe worse than not being able to be active in your 60s. So by the time I made it to Covenant, Dr. Farr is the doctor that I went to, and he eventually agreed to do my surgery, and basically was life-changing for me.
Yeah, when I first met RaeAnne, she came in and could hardly walk. She had to step from side to side. Her hips didn't have a normal motion. She had a hard time just getting out of a chair. She couldn't get out of her pickup, and was miserable. And she had been in a couple other places and just couldn't get relief from her pain. And so we decided to kind of do a little workup and find out what was wrong.
Dr. Farr was an amazing comfort from the first moment I walked into his office. He let me tell him my story. He let me tell him how it was affecting me and how it was affecting my life. And then he set out a plan of treatment for me. We didn't immediately go into, you need surgery. He wanted to ensure that that was indeed what I needed, that would be the best treatment for me and the best option to correct what was going on and to give me a better lifestyle.
Well, when we got some x-rays and took a little further look into her hips, she had some hip dysplasia she probably had since she was a child, and had developed bone-on-bone arthritis at a very young age. And so she had severe arthritis, which you shouldn't really get that young. Well, I wanted to make sure we had exhausted conservative treatment, so we did some conservative things that just didn't work. The treatment for bone-on-bone arthritis, severe arthritis, is a hip replacement. And so really the only option was, well, do we replace someone's hips this young and give her a quality of life now, or do we wait until they're older? And with the severity of her arthritis and how much this was limiting her normal activity, we opted to do a hip replacement.
I did have 2 procedures. The first procedure was on my right hip. It was the complete replacement, and that was done in May of 2015. And once I healed from that procedure, we did the second procedure in October of 2015, which was a full replacement as well. The orthopedic department was helpful through the entire thing and very comforting, as far as letting me know what I would be going through during the procedure and what we would need to do for my recovery following the procedure. And that went straight into the therapy department here at Covenant. They were very helpful. They gave me that extra push when I needed it, and they were absolutely amazing throughout my entire recovery. It's hard to describe how very much my life has changed, and especially without getting emotional, because I can do so much more now that I couldn't before. I enjoy my life. Sorry. I can be active with my niece and nephews. Everyday activities. Something as easy as putting your socks on is no longer an ordeal. It's just part of life. And when you don't realize what an impact something as simple as that is, once you're able to do it again, it's just overwhelming sometimes. Little things like going to Walmart and fast-paced walking through the parking lot to get back to the car. You notice those things. And when I said life-changing, that's exactly what I meant. It's literally a life changer.
And once we got that other hip done, she just kind of took off. She's, was able to do exercise, do her normal activities, and just do a lot of things she wasn't able to do. And from her, to see her going from, just walking, barely walking from the waiting room to back to an exam room and hardly being able to walk, to just walk in here like anybody would, with a normal gait and without a limp and no pain, was pretty rewarding.
The orthopedic department at Covenant Health Plainview helped me get my life back. I'm very active in Relay for Life, Mark Marley's Memorial Go Big or Go Home Barbecue Bash, Cotton Barons Ball, basically any American Cancer Society event that occurs in Plainview, as well as other civic activities here in Plainview. And I did those before and was an active part of that, but now it's pain-free. I can do those things without having to struggle through them. I would not only recommend Covenant Health Plainview and the orthopedic department, but I would encourage anyone that is having hip pain or any joint pain for that matter to seek out the orthopedic department here in Plainview and consult with them. I lived with pain for way longer than I should have, and had I gone to them before, then I think that I would have been able to have that quality of life, this quality of life, much sooner.